Hi there, my name is Abby Price, and I'm going to be discussing the topic of the opioid epidemic within the state of Utah. The reason I'm so interested in this topic is that my aunt was a drug addict. I never knew her before she died. She overdosed. And I never met my cousins or my uncle until I was 18 years old. Her addiction just kind of took over, and I was unable to see her family, and she kept them from having real familial and trusting relationships. So the first thing I want to talk about is what opioids actually are. Like, where do they come from? What are they classified as? Things like that. So on the screen, we have a picture of this plant. This is the opioid poppy plant, and it creates the natural chemical opium, which is what is in opioid drugs. The illegal classes of opioids are, or legal classes are oxycodone, hydrocodone, codeine, and morphine. The illegal ones are heroin. What are they used for? Opioids are most commonly used for pain relief. For example, if you've gotten your wisdom teeth out, you most likely wore prescribed hydrocodone to help you with that pain. In Utah, prescriptions are written at a rate of 57.1 per 100 prescriptions, whereas the national average is 51.4 per 100 prescriptions. As we increase the rate at which people are in contact and accessible to these drugs, we increase the risk of their addiction. And 21.9% of people prescribed opioids do misuse them. How do opioids act on our system? What they do is they release neurotransmitters, endorphins, and dopamine, which are these endogenous opiates. They travel to a site of pain, and they inhibit the release of this substance P. That's how we feel pain. So the opioids help us release more endorphins, more dopamine, which numbs the pain so we don't feel it. How exactly does this influence us and our systems? So like we said, opioids really influence the release of neurotransmitters, and these create that high feeling, and they're relayed in the nucleus accumbens. This center is the pleasure center of our brain, and it's that area where we feel that relief and that high, that good feeling. As opioids release an increased amount of endorphins, so we have not only the dulled pain, but we have that high, good feeling. As more endorphins are released, as one takes more opioids, they become addicted to this high. And as they do so, our body, because the opioid does it synthetically. As you do this, someone will experience tolerance, and that will increase their likelihood of addiction as they have to take more of the drug to get that same high. This also causes alterations in our prefrontal cortex, which results in an inability to focus, make decisions, or behave properly. We also will have issues with our amygdala. This is the emotional center of our brain, and as commonly with drug addicts, they're more irritable, easier to anger, things like that. So is it just opioids that cause these problems? No, all drugs can do this to get that same high. Because of this, prescriptions are usually only prescribed for 3 or less days to reduce this accessibility to opioids. So who's affected by addiction? It's not just the person who is addicted, but it's everybody around them. It's their family, their children, their friends, and especially children as they're growing up. Many may experience neglect, emotional, physical, or sexual abuse, may be underfed, underappreciated, and so much more. One issue that is creating a fear in many and becoming more relevant within the opioid epidemic is the use during pregnancy. In 2019, 7% of pregnant women said that they had an opioid prescription during their pregnancy, and 1 in 5 of these women abused this prescription. For mothers, this increases the risk of maternal death, and for babies, it increases the risk of poor fetal growth, stillbirth, and neonatal abstinence syndrome. This website, Epidemic.org, gives a lot of educational information, and one story I liked was about Dustin, so I recommend going to watch it. And his just highlights the influence that addiction has on family, as he discussed how he lost his relationships with his family. So who is at risk? Although people may have a good health history and no experience with drugs, these people still can have an increased risk for drug addiction and drug use. Those who are also thrill seekers may experience this same addiction and that same desire to want to try these detrimental behaviors. As of now, There are no differences in the rates at which different races or ethnicities experience opioid addiction. From 2013 to 2017, rates of opioid-induced death for Blacks increased from 19.3 to 41.9 per 100,000 people, whereas deaths for whites were ages 25 to 34 increased from 36.9 to 58.3 per 100,000 people. Similarly, across all races, the age range that has the most common use of opioids is those ages 18 to 44. So how can we help? The important thing is to be a good friend. Let somebody know that you're there and there's a safe space where they can come and be there to help them get that help that they need, and get them in contact with resources such as rehabilitation centers or therapy centers. One controversy is that doctors are causing this issue as they prescribe these opioids, but how are we fighting against this? Many doctors are actually approved to prescribe opioids, and medical schools are starting to implement opioid training with their students. Along with this, there's replacement therapy where they can take drugs such as the effect this has on the neural connections in the brain, and they're less damaging, but create that same high, so opioids can be weaned off. Another suggestion is to conduct in-depth cognitive and pre-surgery exams to test the mental stability of a patient and to see if alternative routes of pain relief need to be taken. Furthermore, despite the efforts made over the years, we can do better to educate the general population and those in healthcare. As we do so, we can be better friends and be more helping. And as people in Utah, I recommend, again, going to the Epidemic.org website to learn more about the opioid epidemic and ways that you can help.